This surgical technique is a recommendation of Implant Direct. Implant Direct is a medical device manufacturer and does not dispense medical advice. Clinicians should use their own judgment in treating their patients. Socket preservation, preserving dental health and appearance. When a tooth decays and needs to be removed, the absence of the root causes the bone to collapse. As the bone collapses, the tissue sags and moves along with the bone loss. This bone loss can affect the outward appearance and symmetry of the face. Significant bone loss can occur in as little as 2 months. It is essential that the tooth socket is preserved with bone grafting. Preserve sockets after extraction in order to minimize bone loss and complications to adjacent teeth. Maintain and regenerate bone for implant treatment. Preserve patient appearance. Socket preservation, bone grafting procedure. Prepare direct gen allograft by covering with a sterile isotonic solution for up to 30 minutes. Extract the tooth gently, maintaining as much bony structure as possible. Thoroughly debride the socket, removing remnant periodontal ligament tissue and inducing some bleeding. Soft tissue grows at a faster rate than bone. Occluding the soft tissue allows for more time for bone regeneration. A membrane is recommended to protect and maintain the bone graft, as well as help stabilize the blood clot. Loosen the tissue so a barrier membrane can be placed 2 millimeters down on the bone surface, both palatal and facial. If primary closure can be achieved, a resorbable membrane can be used. Otherwise, a non-resorbable is recommended. A membrane can be cut to the size and shape needed, round any corners to avoid possible disgents of tissue. If using a textured non-resorbable membrane, place the textured side towards the soft tissue. Tuck into the side of your preference first. A flap can be laid if it is too difficult to tuck into the membrane. Gently fold over to test for complete coverage of the defect. Use a bone graft spoon to apply allograft to the socket. Place direct gen allograft into the socket site. Lightly pack with a packer. Do not overpack, as space is needed between the particles for bone to regenerate. Repeat until the desired amount of bone graft material is achieved. Isolate the defect from soft tissue growth by folding over the membrane and inserting it into the other side. The site requires primary closure, and sutures need to be tension-free. If primary closure cannot be attained, a non-resorbable membrane is recommended. After 1 to 2 weeks, check healing at the graft site and remove sutures if needed. After 4 weeks, remove the membrane if a non-resorbable was placed. After 3 to 6 months, the graft is fully integrated with the jawbone.